and welcome to Pharm To Home with Thomas McDowell, registered pharmacist Thomas McDowell.
Yep. Thank you, Sandra. Glad to be here.
And I'm so glad to have you here, Thomas, because you have a really good topic every time you come.
Well,
and this is a good one because the safety of medication knowing about the safety of medication is very important.
Yeah, it's a broad topic, and I'm doing a presentation with the local senior center today on the same topic. So I figured why not go ahead and talk about it.
Absolutely.
On our Pharm To Home segment. And when we talk about medication safety, we're not just talking about side effects or abuse.
Right.
We're talking about all aspects, including medication adherence,
right,
medication overuse, which is not necessarily the same as abuse, medication underuse, and proper medication selection based on age, physical condition, disease states, etc.
Right.
So there's a lot of aspects about medication safety. And as my grandfather used to say, there's just as many reasons to not take a medication as there are to take one.
Right.
And so there's a lot of factors that go into that decision from your prescriber, from your doctor, and then you have a team, your pharmacy team that's looking out for you as far as safety as well.
Absolutely. And that, again, is why you need a relationship with your pharmacist.
Exactly, and prescribers have medication knowledge and training, but we have very specific medication knowledge, and we can be that that safety net for patients and making sure that medications are safe and appropriate and clinically appropriate for our patients, and making sure there's no interactions, side effects, duplications, etc.
Let me ask you a question. Do you call a doctor, this is hypothetical, do you call a physician if you see that they have prescribed something? And I'm sure this can get by a doctor, they're busy. If you see on their chart or my chart or whatever, or on our record, that you are allergic to that medicine that doctor has prescribed, do you call the physician and say, hey, I have it on our record that they are allergic to this? Have you done that before?
Oh, absolutely. That's a great question. Fairly common situation. Usually if there's different doctors involved and they don't necessarily have an updated record, but they prescribers and primary care providers and specialists, they really do a great job of keeping their records up to date, which keeps patients safe. But every now and then there'll be, maybe it's a new allergy that the patient didn't have before when they were originally seeing that doctor. And so we have, in our software system, a lot of checks and balances and, red flags when an allergy is on the record that it'll pop up, and we'll check on it. We'll call the doctor and ask them. And they're usually, very appreciative of having somebody looking out for them and the patient. And so that we're able to call, and that's really what a local pharmacy is going to be able to do, especially is make those calls, go above and beyond. Most all pharmacists will call about an allergy, but getting into the interactions and the duplications, and the clinical appropriateness, you're really going to have more benefit at a local pharmacy that you have a relationship with, because we know you. I know that I talked to you the other day and you were having these side effects with this other drug, and now you've been prescribed a new one with similar side effects, and so I'm concerned about how that's going to affect you. So having that relationship is key, like you said.
Absolutely.
And so we mentioned taking age and physical condition into account. So when you age, medications may you may respond to medications differently.
Right.
If you're on more medications or if you have other disease states, all of those things are interconnected in how you respond to certain medications. And so the addition or subtraction of prescriptions can affect you. So it's always important to know what you're taking and to ask questions about what you're taking and making sure it doesn't interact with other prescriptions. And that's what we're going to do for you at Medical Park Pharmacy is look at your whole profile and keeping all your medications at one pharmacy. I cannot stress enough.
Yes,
it's very,
I can
very
imagine.
important, because we can't see what you're taking, except for controlled substances. There's a registry where we can see that, but we can't see other chronic, maintenance medications if you filled them elsewhere. And so you're putting yourself at risk of having interactions that your pharmacist can't see. And so it's really important to try to avoid that best you can and
That's
have
a good
everything.
point.
We call that polypharmacy when you're using multiple pharmacies.
Right.
And if you're worried about, a lot of times people do it because they're chasing the best price, and
Yeah.
I understand that. But ask your pharmacist about more cost-effective options, and you can probably save more than you would in money and time trying to figure out a cheaper option. So ask about your copays, ask about your costs. We have a lot of insight on that. And that's important because cost can be a barrier to taking your medications
Right.
appropriately. And when it comes to safe medications, there's actually a list that the American Geriatric Society keeps updated. It's been around a while. It's called the Beers List. And it's a comprehensive list of medications that older people should potentially avoid or consider using with caution because they pose unnecessary risk and side effects for the older population. And so usually medication safety is most relevant towards our seniors because they're usually taking more medications. And that Beers List is something that pharmacists are very familiar with, and we know what's on there. So if we see a lot of, especially multiple of these medications, I'm immediately going to be worried about a falls risk in the home
Right.
or out in the community. And we all know that when somebody this elderly has a fall, it can be really, really dangerous
Yes.
and detrimental
Devastating,
and really
yes.
hard to recover from.
Absolutely.
They may have to go to the hospital, then a skilled nursing facility, and then rehab there, outpatient rehab. And sometimes they never get back to that previous functional state. And so if we can potentially avoid that with appropriate medication use,
Yes.
I think everybody would
Absolutely.
like to do that. So knowing, kind of what the side effects are of medications and having a relationship with the pharmacist and the provider is important. So some of those meds, just so, throwing some of them out there, just because you're on this doesn't mean you need to panic and
Right.
say, I need to get off of it immediately. But it's something to consider, especially if you're feeling drowsy at home right now. If you take your medications and you feel a little groggy, drowsy, talk to your pharmacist about what's going on.
So if you're taking a medicine and it makes you feel just terrible, it's a new medicine your doctor has prescribed, because everybody reacts differently to medications, right?
Yeah.
You might not react the same way I do.
That's right.
So it's best to contact your pharmacy. I would go to the pharmacist first because it is a little harder to get in with the primary doctor. So if your medicine is making you feel really bad, it's a new medication, shouldn't you tell your pharmacist
Yeah.
or your physician?
Yeah.
I mean, you don't have to go every day feeling really, really bad because there may be an alternative drug. Is that right?
Yeah, absolutely. And so we try to counsel our patients up front when they're coming in to pick up a new medication. But if that doesn't happen, or if counseling's declined and they have questions later, we definitely encourage you to call us. And calling the pharmacy first is I believe what most prescribers would encourage you to do, because we can
yes.
talk to you about the side effects, and they want you to take that medication. They chose it for a reason. And so it might just be something as simple as taking it with food.
And some physicians ask the pharmacist.
Yeah,
They
absolutely.
consult with y'all, don't they?
Yeah, we have great relationships with the providers in our building. They'll call us and ask us, insurance questions, medication questions, interaction questions, and
Right.
Having that collaborative teamwork is really important for optimizing patient care, and having everybody on your team work together
Sure.
is critical. And so we want you to ask us about these medications. I'll have folks call me sometimes, and we're busy, but they'll say, I'm sorry to bother you. I have a question about my medication, and I tell them, you're not bothering me. That's what I'm here for.
This is our job.
Yeah, that's why I'm here. I want you to call me and ask these questions. And so that's important, because it might be something that we can overcome without changing the drug or without calling the provider. And so if it's something like taking it with food versus not taking it with food, or taking it in the evening versus the morning, that kind of thing. So
Right.
we can really provide some options for you. And if it's something that it's just still not working, or if we need to bring in the physician, we can do so. But some of those drugs, just to give some examples, first generation antihistamines, that's like Benadryl.
Mm-hmm.
Benadryl, a lot of folks use it occasionally for sleep. It's over the counter, so it must be safe, right? Well, it can cause a lot of drowsiness, and there's even some link to dementia. There's some early studies that are showing a little bit of link there. No big studies that are definitive, but the mechanism makes sense clinically, and so that's a drug that I don't recommend using frequently. It does have its place for allergic reactions and that kind of thing, and occasionally maybe for sleep or allergies, but it can be dangerous in terms of the drowsiness that it causes, especially in seniors. Muscle relaxers, they can cause a lot of drowsiness, anxiety medications, so benzodiazepines like Xanax, Ativan, Valium, they can cause a lot of drowsiness, so you have to be careful with those. Anticholinergic drugs, there's a lot of anticholinergic drugs that are used for GI, to kind of slow things down and keep you from having an upset stomach. They cause a lot of drowsiness too. You're hitting some of those same receptors that Benadryl hits, and so they can help you with your GI situation, but they can cause drowsiness. Long-term NSAIDs, ibuprofen, can cause some kidney damage and stomach issues if you use it frequently over time, especially without taking it with food and water. So even over-the-counter medications have safety concerns, and so that's really important as well.
Do you recommend taking most medications with food?
There's a group of medications, varying classes, that are better absorbed without food.
Okay.
But otherwise, perfectly fine to take most all medications with food. Some of them need to be with food. Then there's kind of your subset that it doesn't matter, and I tell folks, if you're having an upset stomach, try it with food.
Okay.
It's gonna typically help ease some of that upset stomach from the drug. You've got some food on your stomach, you're producing acid,
yes.
You've got an environment that can accept that drug instead of just throwing it in there. Because our body reacts, when we're hungry, we start producing acid. Our body prepares for food. But if we're just throwing a couple of pills down, our body does not know that we're doing that. And so that can kind of make it sensitive and cause some nausea for some people, not everybody.
It's amazing what our body knows.
It is. When you're hungry.
How receptive our body is.
I know. Just the fact of being hungry starts a reaction to prepare to digest food properly. Saliva starts producing, and we actually, our saliva helps digest food. That's a whole nother topic, but real quick, I know we're running out of time, but medication adherence is another big topic. So medications are safe only, if you're taking them, if they're appropriate, and if you're taking them properly. So if you're not taking them properly, or you're missing doses, or you're overusing them or underusing them, you can have issues. Medications do not work in patients who do not take them.
Right.
That's a quote, but we have some solutions
so true.
at the pharmacy. Our MacPack program that we've talked about, our medication adherence.
That is a great program.
Packaging program. We have hundreds of patients utilizing it. We sort medications by date and time in easy to tear strip pouches.
Yes.
All the medications are filled one time a month, delivered to your door. It's a free service. We monitor your medications monthly, coordinate your refills, coordinate your delivery date, communicate with your provider, and we do all of that for free. You just pay your normal copay. So if you're struggling with your medications and it's becoming a huge burden, it doesn't have to be that way, and you don't have to call in, a bunch of help. If your family's out of town, call your pharmacy, call us at Medical Park Pharmacy. We'd love to help you. 252-443-7979. We're in the Medical Park building, often called the Boyce Willis Clinic building at 901 North Winstead Avenue, and we would love to be a resource for you in all things medication safety. So look forward to serving you, and appreciate you having me on, Sandra, as always.
This was great, Thomas. I always enjoy you coming. Looking forward to the next Pharm To Home. So
absolutely.
Anyway, he'll be back in 2 weeks, and we'll be right back right after this.